Mr. Blaze, let's quick address that issue. The 2.3 million children that have lost coverage under Medicaid. Can you explain that?
Yeah, it's a deeply misleading statistic. If you look at combined Medicaid and CHIP enrollment from before the pandemic to 2026, there's actually a higher percentage of children on Medicaid and CHIP in the first part of 2026 than before the pandemic. One of the issues is we have fewer we have fewer births in the U.S. because of the fertility decline than we have children who are moving off the Medicaid program because they age off of it. So when you account for those factors and you look at it as a percentage of all kids, there's actually a higher percentage of kids enrolled in Medicaid and CHIP than before the pandemic.
I appreciate you explaining that. Mr. Schneider, there were 4 primary reforms in the first reconciliation package. The first one was requiring states to redetermine eligibility every 6 months rather than a year. Do you have a real problem with that? I mean, do you want people who are ineligible to be on these programs?
I believe that the program should be only for people who are eligible.
So is there anything wrong with states redetermining eligibility? Because a lot of states obviously don't. They haven't been.
I think the state should have some flexibility in how they administer their programs. The previous
You're not answering the question. I mean, is there a problem with rechecking eligibility?
There's not a problem with
There's nothing
rechecking.
draconian about that, correct?
There's not a problem with rechecking eligibility.
Okay, good. Next, are provider taxes and provider fees, is that health care?
States are sovereign political entities.
Is that health care?
Health care is in part how it gets
The answer
paid for.
is no. Mr. Blaze, so when states charge a provider fees and taxes, correct? For a Medicaid recipient, the provider gets reimbursed that amount, right? But again, the states are charging that for services across the board, correct? So isn't it true then those provider fees and taxes artificially drive up the cost of health care for people on private insurance or for people on Medicare?
They do. We actually have a study from looking at a tax that California imposed that it increased commercial prices by about 4%.
So isn't it true that, and you said in your testimony, President Biden called that a scam. President Obama recommended doing exactly what we did in the One Big Beautiful Bill. That's not cutting and slashing Medicaid, right? That's just actually implementing what both President Biden and Obama recommended.
That's correct.
So that's the second reform, the One Big Beautiful Bill. State-directed payments, and this one is kind of baffling. Can you describe a little bit more what that is? And intergovernmental transfers, where the states plump up what they charge or reimburse, like their state-owned ambulance services. I mean, can you describe that?
Yeah, so let me do state-directed payments first. On the fee-for-service side of Medicaid, there is a cap at Medicare rates. It's called an upper payment limit. That cap does not exist on the managed care side. So as states have moved Medicaid enrollees into coverage through insurers, they've realized that they can create these provider tax and financing gimmicks, get the federal funds, and then lavish much higher payments on the big hospital systems. So what the One Big Beautiful Bill did was extend the limits that were on the fee-for-service side of Medicaid to the managed care side.
So, Mr. Schneider, does it make any sense to you whatsoever that for every dollar a state spends on a disabled child or blind elderly individual, they get reimbursed, again, in the federal match, they get reimbursed $1.33. But for every dollar a state spends on a single, childless, working age, able-bodied adult, states get $9 in reimbursement from the federal government that's $40 trillion in debt. Does that make any sense at all, that disparity to $1.33 for a disabled child, but $9 for somebody who in many cases should be working? Does that make any sense to you at all?
It's a policy choice that Congress has made. There's similarly, there are differentials.
Again, that's not the question. Does it make any sense to you? It apparently didn't make any sense to President Obama because he recommended equalizing that treatment, correct?
He did. In a 2012 budget proposal called the blended rate proposal, he proposed equalizing the match rates.
Now, would he increase the reimbursement for disabled children, or would we just drop that to a reasonable level? Like, no, if we're going to reimburse disabled children for $1.33, that's what we're reimbursed for.
So he had it as part of a deficit reduction plan. It would have brought up the traditional federal reimbursements for those traditional categories.
You know by how much from $1.33?
I don't recall.
Okay, that's what I've got for the time being. Senator Merkley.
Senator Ron Johnson begins by challenging the claim that 2.3 million children have lost Medicaid coverage. The witness argues that the number can be misleading if it doesn't account for CHIP enrollment, changes in the overall number of children in the country, and children aging out of the program. That's an important distinction because raw enrollment numbers don't necessarily tell us whether children are becoming uninsured. To understand what is really happening, you have to look at Medicaid and CHIP together, changes in the child population, and whether children who leave Medicaid are actually transitioning to other coverage.